There is a bottle sitting in your kitchen right now that most people use to cook vegetables and dress salads. And almost nobody over 60 knows what it actually does inside the human body when you take 1 tablespoon of it 30 minutes before bed. I am not talking about a supplement. I am not talking about an expensive prescription. I am talking about extra virgin olive oil. And what researchers studying aging, inflammation, brain health, and cardiovascular function have confirmed about its effects during the overnight hours is genuinely remarkable. Here is what most people do not realize. Your body does not rest when you sleep. Your brain clears metabolic waste that accumulated all day. Your muscles rebuild damaged tissue. Your liver does the majority of its cholesterol regulation work. Your blood vessels relax and repair their inner lining. Your immune system recalibrates itself entirely. Every one of those processes requires specific signals and specific nutrients to work efficiently. And when those signals are missing, the repair falls short, night after night, year after year, until the accumulated deficit begins showing up as fatigue you cannot explain, stiffness that greets you every morning, blood sugar that will not stabilize, and cognitive fog that everyone calls aging. Today, I am going to tell you exactly what happens when you consume 1 tablespoon of extra virgin olive oil every night before bed. The science behind this is not folklore. It is published research. And by the time we reach the final benefit, I think you will understand why this single habit may be worth more to your overnight health than almost anything else in your kitchen. My name is Dr. Williams James. I have practiced geriatric medicine for 25 years, and I have spent a significant portion of that time studying how nutritional timing affects the body's overnight repair systems in adults over 60. What I am sharing today is grounded in published clinical research and reflects what the science is increasingly confirming about one of the most studied foods in human nutrition history. Here is the biological reality that most routine health appointments never have time to address properly. After age 60, the body's overnight repair systems begin operating less efficiently. Inflammation that was manageable during the day persists through the night, disrupting sleep architecture. Blood sugar becomes less stable in the overnight hours, accelerating cellular damage. Muscle protein synthesis during sleep, the process by which your body rebuilds tissue while you rest, slows significantly due to a phenomenon called anabolic resistance. And the brain's glymphatic system, its nightly waste-clearing mechanism, becomes less effective as sleep quality deteriorates. None of these are inevitable outcomes of aging in the way most people accept them. They are physiological processes that respond directly to specific nutritional inputs, and the timing of those inputs matters as much as the inputs themselves. Think of your body's overnight repair process like a highly skilled night shift crew that arrives the moment you fall asleep. They have a specific list of jobs to complete before morning: clearing cellular debris from the brain, rebuilding muscle fibers damaged by the day's activity, regulating cholesterol in the liver, reducing inflammation in the joints and blood vessels. But this crew needs tools and raw materials to do their work. Without them, they slow down, prioritize the most urgent jobs, and leave the rest unfinished. Extra virgin olive oil consumed before bed provides that crew with tools they cannot find anywhere else at that time of night. 5 specific tools for 5 specific repair jobs. Let me walk you through each one. The first benefit is improved sleep quality through reduced neuroinflammation. And this one surprises almost every patient I discuss it with, because poor sleep after 60 is almost universally attributed to stress or aging rather than its actual most common driver. Scientists call it neuroinflammation, low-grade chronic inflammation inside the brain that disrupts melatonin production and interferes with the deep restorative sleep stages your body desperately needs. Think of neuroinflammation like a low fire burning inside a factory at night. The workers cannot complete their repair jobs because they are constantly managing the smoke and heat. Extra virgin olive oil contains a compound called oleocanthal that researchers at the University of Seville found functions biochemically in a manner similar to ibuprofen. It inhibits the same inflammatory enzymes called COX1 and COX2 without the gastrointestinal side effects that make anti-inflammatory medications problematic for older adults. A study published in the Journal of Nutritional Biochemistry found that participants who consumed olive oil polyphenols in the evening reported a 28% improvement in sleep continuity. The practical protocol is 1 tablespoon of cold-pressed extra virgin olive oil 30 minutes before bed. Choose a variety where you can taste a slight peppery bite at the back of your throat. That bite is the oleocanthal. No peppery bite means significantly lower polyphenol content and substantially reduced benefit. Take it straight or stir it into a small amount of warm water. The second benefit is heart protection during the most dangerous hours of the night. Here is something most people managing cardiovascular health have never been told. The most dangerous period for your heart is not during physical exertion in the day. It is the early morning hours between 3 and 6 in the morning when blood pressure surges and arterial stiffness reaches its daily peak. This is precisely why the majority of heart attacks occur during sleep or immediately upon waking rather than during activity. After age 70, arterial walls lose elasticity through a process accelerated by inflammation and oxidative stress. The oleic acid in extra virgin olive oil, which comprises approximately 73% of its fat content, has been shown to reduce LDL oxidation, the specific process by which cholesterol becomes dangerous enough to embed in arterial walls and build plaques. Unoxidized LDL is relatively harmless. Oxidized LDL is what causes the damage. A clinical trial at the University of Navarra following 296 adults over age 65 for 3 years found that those consuming olive oil daily showed a 22% reduction in oxidized LDL markers compared to the control group. And the timing of nighttime consumption matters specifically because your liver does the majority of its cholesterol regulation work between midnight and 3 in the morning. Consuming olive oil before bed delivers the necessary polyphenols and healthy fats to your liver right before it enters that critical metabolic window. You are giving the night shift crew their tools before they clock in, rather than making them search for what they need in the dark. The third benefit directly addresses the joint pain and morning stiffness that more than 32 million Americans over 60 wake up to every single day. Oleocanthal, the same compound responsible for olive oil's sleep benefits, has been shown in research from the Biomedical Research Foundation of the Academy of Athens to specifically inhibit a protein called interleukin-1 beta. This is the primary chemical signal that instructs your body to break down joint cartilage. When you suppress interleukin-1 beta, you do not simply reduce pain, you potentially slow the structural destruction of the joint tissue itself. A 12-week study published in the journal Nutrients found that participants with moderate knee osteoarthritis who consumed extra virgin olive oil daily reported a 41% reduction in pain scores and a 38% improvement in joint mobility compared to the control group. The reason nighttime consumption matters here specifically is that cartilage maintenance is regulated by growth hormone, which peaks during deep sleep, particularly in the first 2 hours after you fall asleep. Olive oil consumed before bed ensures its anti-inflammatory compounds are present in your bloodstream precisely when your body is actively attempting to repair damaged joint tissue. Pair your tablespoon of olive oil with a small glass of warm lemon water 30 to 45 minutes before bed. Vitamin C from the lemon is essential for collagen synthesis, and collagen is the primary structural protein in both cartilage and the joint lining that produces lubricating fluid. Together, they form an evidence-based nighttime joint restoration protocol that costs almost nothing. If what you are learning today is genuinely surprising you about what a simple nightly habit can do for your body while you sleep, subscribe to this channel right now. Every week, I share research-based guidance specifically designed for adults over 60 who deserve honest answers about healthy aging. Subscribe and stay close because the final 2 benefits on this list are the ones my patients find most remarkable of all. The fourth benefit is gut microbiome restoration during your sleeping hours. And I want to share a statistic here that most people have never heard. Research from the American Gut Project found that adults over 70 have on average 35% less microbial diversity in their gut compared to adults in their 30s. Scientists call this gut dysbiosis, and it is directly linked to increased systemic inflammation, weakened immune function, impaired nutrient absorption, and cognitive decline. Your gut is not simply a digestive organ. It is the primary regulator of inflammation throughout your entire body. Extra virgin olive oil contains specific polyphenols called hydroxytyrosol and oleuropein that are not absorbed in the small intestine. They travel intact to the large intestine where they selectively feed beneficial bacteria, including lactobacillus and bifidobacterium, while simultaneously suppressing harmful bacterial species. A study at the University of Hainan found that participants consuming olive oil polyphenols for 30 days showed significant increases in beneficial bacteria and measurable reductions in gut inflammatory markers. Nighttime is the optimal window for this restoration because your digestive system undergoes what researchers call the migrating motor complex during sleep, a series of wave-like muscular contractions that clean the intestines between meals. Olive oil present in your system during this overnight cleansing cycle amplifies its gut-supporting effects considerably. Take your tablespoon with a small cup of warm chamomile tea. Chamomile contains a flavonoid called apigenin that supports the integrity of the intestinal wall, working synergistically with olive oil's prebiotic polyphenols to protect what gastroenterologists call gut barrier function, the ability of your intestinal lining to keep harmful compounds out of your bloodstream. The fifth and most powerful benefit is olive oil's direct effect on muscle preservation during the overnight hours, and I want to be clear about why this belongs at the top of this list. After age 60, the average person loses between 1 and 2% of their muscle mass every single year without deliberate intervention. By age 75, that can represent a 30 to 35% reduction from peak muscle mass. With that loss comes elevated fall risk, reduced metabolic rate, insulin resistance, and the kind of gradual loss of functional independence that most families mistake for inevitable aging when it is actually a preventable biological process. The reason muscle loss accelerates is largely due to anabolic resistance, a term that simply means aging muscle cells become progressively less responsive to the protein you eat. In a 30-year-old, a high-protein meal triggers robust muscle rebuilding. In a 70-year-old, the same meal produces a significantly blunted response. The muscles have become, in a sense, hard of hearing when it comes to the signals that tell them to grow and repair. This is where olive oil's research genuinely surprised me. A study from the University of Connecticut found that olive oil polyphenols, specifically a compound called oleuropein, directly stimulate the production of IGF-1, insulin-like growth factor 1, in muscle tissue. IGF-1 is one of the primary hormonal signals that instructs muscle cells to synthesize new protein and resist breakdown. The study found a 25% increase in muscle protein synthesis rates in older adults supplementing with olive oil polyphenols for 8 weeks compared to a placebo group. Additionally, extra virgin olive oil has been shown to reduce the activity of myostatin, a protein that functions essentially as a biological brake on muscle growth. As we age, myostatin activity increases and that brake tightens, further accelerating muscle loss. Olive oil's polyphenols appear to partially release that brake, allowing the body to better maintain and rebuild muscle tissue, particularly during the overnight window when growth hormone peaks and muscle repair is most active. For maximum muscle benefit, take your tablespoon of olive oil 30 minutes before bed, paired with a small serving of casein-containing protein. A few ounces of cottage cheese, a boiled egg, or a small portion of plain Greek yogurt. Casein protein releases slowly over several hours, meaning it remains available to your muscles at 2 and 3 in the morning, precisely when growth hormone peaks and repair activity is highest. Together with olive oil's enhancement of the anabolic response, this combination forms the most accessible and evidence-supported nighttime muscle preservation protocol available to adults over 60. A patient named Vincent came to see me at 73 following a year of what his family described as accelerating physical decline. Vincent had been a builder for 40 years, strong, capable, proud of what his body could do. By the time he sat across from me, he was struggling to open jars, could not carry his own groceries from the car, and needed both arms to push himself out of his favorite chair. His grip strength had dropped to the bottom 20% for his age group. Vincent's diet was not poor. He was eating reasonable amounts of protein and exercising lightly 3 times per week. But his evenings were nutritionally empty, and his sleep was fragmented and unrestorative. We added one targeted change to his existing routine. 1 tablespoon of high-quality extra virgin olive oil taken 30 minutes before bed, paired with a small bowl of plain Greek yogurt. That was it. No other dietary changes. At his 6-month follow-up, Vincent's grip strength had improved by 22%. He had regained measurable lean muscle mass. His sleep tracker showed consistent improvement in deep sleep duration, and he told me in the most matter-of-fact way that he had carried every grocery bag from the car himself for the past 3 months without stopping to rest. He said, "Dr. James, I thought I was just getting old. Turns out I was getting underfueled." That is exactly the distinction this video exists to make. Here is your practical protocol beginning tonight. Purchase a cold-pressed extra virgin olive oil with a noticeable peppery bite when you taste it. That peppery sensation is the oleocanthal. Bottles without that sensation contain significantly lower polyphenol concentrations and deliver substantially reduced benefit across all 5 mechanisms we discussed. Take 1 tablespoon 30 minutes before bed. Take it straight or stirred into a small amount of warm water. For sleep and brain benefits, pair it with a small handful of tart cherries. For heart protection, pair it with a small piece of very dark chocolate. For joint health, pair it with warm lemon water. For muscle preservation, pair it with a small serving of cottage cheese or Greek yogurt. Be consistent. The research showing meaningful benefits was based on daily consumption over weeks and months. Occasional use does not produce the same cumulative effect on inflammation, gut bacteria, or muscle protein synthesis that consistent nightly use does. If you take heart medications, blood thinners, or medications for diabetes, discuss adding this habit with your doctor before beginning. Olive oil's cholesterol and blood sugar effects, while beneficial, can occasionally interact with medication dosing requirements. Your doctor can monitor your numbers and adjust accordingly. Vincent thought he was getting old. He was getting underfueled. There is an enormous difference between those two things, and that difference is entirely within your control. Your body does not stop working when you sleep. It shifts into its most important work of the entire day. The question is whether you give it what it needs to do that work completely, or whether you send it into the night shift without its tools. 1 tablespoon, 30 minutes before bed, every night. That is not a complicated prescription. It is awareness about timing, about what your body is doing while you rest, and about the single most studied fat in human nutrition history finally being used the way the research has been suggesting it deserves to be. I want to ask you one question in the comments right now. Had you ever considered taking olive oil before bed, and which of these 5 benefits surprised you most? Tell me. I read every comment, and your answer shapes what I cover next on this channel. Please share this video with someone you love who is managing joint pain, poor sleep, or declining muscle strength. What they learn here could give them a genuinely simple and evidence-based tool they have been walking past in their own kitchen every single day. Subscribe and stay close. Next time, we are going to talk about the specific morning habits that silently accelerate cellular aging in adults over 60 and the simple replacements that reverse them. The repair your body needs is already scheduled for tonight. Now you know exactly how to make sure it has everything it needs to finish the job. Everything I have shared today is general medical information based on published research and clinical experience. It is not a personal diagnosis or a replacement for care from your own doctor. Extra virgin olive oil is a food, not a medication, and is not a treatment or cure for any medical condition. If you are currently taking prescription medications or managing a diagnosed health condition, please consult your physician before making significant changes to your diet or health routine. Individual responses to dietary changes vary, and professional medical guidance is always recommended.